starting with the name of God. In this lecture, we will know about the chalazion or chalazion. Some people call it chalazion, some people call it chalazion. Now, we have already studied about the meibomian glands which are present along the dorsal plate. This is the dorsal plate and these are the meibomian glands. And if we look at the margin of the eyelid, so these are the orifices or opening of the meibomian gland. If we look it from the ventral side, so on the upper eyelid there are about 30 to 40 meibomian glands, and on the lower eyelid there are about 20 to 30 meibomian glands. Now look here, if we look these are different a lot of meibomian glands. If we look this single one, so here this is the meibomian gland and it is its ducts which secrete its lipid secretion to the eyeball. Now these secretion are sebaceous secretion which are lipid secretion. Now look at the chalazion pathogenesis or understanding of the chalazion or what is chalazion. What happened that the meibomian gland outflow or its duct become obstructed or blocked due to unknown reason and or due to infection, but here the infection will be very much mild, so it can't be detected or it cannot make the things so much disoriented or disturbed. So here or or this infection cannot be detected through a laboratory test. So what happened after the obstruction that the sebaceous glands accumulate a lot of fluid secretion that is secreted by that gland or the meibomian gland. Actually, meibomian gland is a modified sebaceous gland. Now, what happened that a sac is formed or acinus is formed at the region of that gland which duct has been blocked. So it formed a gland acini swelling because of the accumulation of the lipid fluids. Now, what happened? There are four characteristics of this chalazion. Starting with the name of God. In this lecture, we will learn about the chalazion or chalazion. First of all, we have already studied about the dorsal plate, which is there, and along its side there are different meibomian glands. And if we look at the eyelid margin, so these are the openings or the orifices of the meibomian glands. If we look from the ventral side, so in the upper eyelid there are 30 to 40 meibomian glands, and on the lower eyelid there are almost 22 to 30 meibomian glands. Now, if we look closely, this is a single meibomian gland and it is its duct. Through this duct, it secretes its fluids to the its fluids to the eyeball. As we know that it is a modified sebaceous gland, so its secretions is a lipid secretions. Now, to understand the chalazion, what happens? The duct of the meibomian gland become obstructed or blocked. So when its outflow is blocked, so there may be a cause, but the cause may be unknown or it may be due to infection. But this infection is very much mild, so it can't be detected. That's why the this is chalazion is also called that it is a sterile infection. Okay. Now what happened when the sebaceous fluid or the lipid fluid which is secreted by this meibomian gland accumulate within the gland, due to which this gland becomes swell like a cyst or like a sac filled with fluid. So it is, we can say it that gland is in swelling. But here, in case of chalazion, four are the main characteristics. Number first, it is chronic. It takes times to develop. Number second, it is sterile. As I have already discussed it, that we cannot detect the infectious agents here. Number third, it is inflammatory. Here, inflammatory system is also activated, and we found a lot of inflammatory cells like neutrophils, lymphocytes, granulocytes, etc. And number third, as we already know that here are lipid secretion. So this lipid secretion accumulate and it form a nodular structure, which we can say that it is a granule. So it is also called lipogranuloma. So a chronic sterile inflammatory structure, which is a lipogranulomatoid structure, is called chalazion. So these are the four main characteristics, and it is MCQ's point of view which you must learn. Now come to the pathogenesis. As we have already discussed that if this duct is blocked, so the accumulation will occur here. So this becomes swells like this, so it is almost a sake phylloid. Okay, so here is the block meibomian gland and here is the swell meibomian gland. So what happened, it formed a lipogranuloma which is sterile, chronic and inflammatory. Now what happened, obstruction of the duct of the meibomian gland, lipid secretion accumulate which activate inflammation, and this inflammation is actually chronic inflammation because it takes times to develop. Now what will happen, that epithelioids or giant cells comes and surrounds that lipid secretions, okay, or that gland, due to which it become a granuloma like structure. That's why it is also called lipogranuloma structure or lipogranuloma or chronic steroid inflammatory lipogranuloma. So what happened, that again different inflammatory cells came here to the gland and also surrounds the gland along with the epithelioid cells in giant cell. So these inflammatory cells include lymphocytes, neutrophils and plasma cells like B cells or T cells. Now what will happen, they form a large swelling structure which is called chalazion. Now its clinical features or clinical presentations, what they are saying that it is most common on the upper eyelid. And what is the reason, because on the upper eyelid we have 30 to 40 meibomian glands, while on the lower eyelid we have 20 to 30 meibomian glands. So we have more meibomian glands on the upper eyelid, so we have more chances of chalazion on the upper eyelid. Number second, which is very much important, that it is painless, and this distinguishes it from the hardulum which is painful. We will study it in the next lecture, but it is very important in MCQ's point of view as well as in the diagnosis. Number third, this swelling increases in size without any external signs of inflammation. This is also one of the differential diagnosis with the hardulum. Number third, if we palpate it, it will feel like a small nodules on the upper eyelid or on the external eyelid. And if we avert it, the conjunctiva will looking like a red or yellowish. It is like here. We have averted it, so this is the conjunctiva which look like a yellowish red. Number third, it is always away from the margin. This is very much important in the differentiation with the hardulum. Now look at it, it is away from the margin, and look here, it is in the margin. So this is also one of the differential diagnosis between these two. And other is, if it increase very much in size, what it causes, it comes in core the cornea. Like if it is too much increase in size like this, it becomes this much, so it will core the cornea. And number third, the our regulatory movement of the eyeball will disturb because this cornea will move this side to look forward, so it causes astigmatism and press cornea which lead to the blurring of the vision. Now what is its fate? uh, Number first, it may be resolved on its own. Number third, it may liquefy which produce a sex like structure which is called meibomian gland, yeah, or meibomian gland. It may undergo fibrosis, which lead to a hard nodules, or it may be undergo calcification, which lead to a very hard nodule. And we can say that it can undergo infections if we do not care about its sterilization, and it may undergo bursting, which again becomes prone to infection. Like here, you can see in this diagram, it is bursted. This is bursted nodule, and if you look at here, it is also a pale color. These are the diagrams from the Jatoi book. This is on the lower eyelid lesion, and you look at it, it is not too much red. It's, one can say that it is an inflammation. Complications of a chalazion. The first one we have is ptosis. Now look at this picture. These are two normal eyes. What is ptosis? Ptosis is actually the dropping of the eyelid. If we look at this eyelid, which is normal, and if we look at this eyelid, this one is dropped. It is why dropped, because here is a type of chalazion which mechanically stress it and forcing it to drop. This is called ptosis due to a chalazion. Number second, we have astigmatism when it is on 12 o'clock. Now I am also explaining it that how it is, because astigmatism and astigmatism leads to blurry. Here it is the chalazion at 12 o'clock, and now here is no space with us to look for, so the eyeball moves at medial side to look forward. Now if he is looking in this side, he will not look norm, he cannot see things normally, but he will see things very much blurred, so it can cause blurring of the vision. So these were the two complications about the chalazion. Now what is the differential diagnosis you have to look for is, first of all, sebaceous gland adenoma, because we have the meibomian glands which are sebaceous gland but modified sebaceous gland. So any sebaceous gland here can look like a chalazion. So according to this similarity, we have to differentiate between sebaceous gland adenoma and the chalazion. Number second is the carcinoma of the sebaceous gland. Number third is sarcoid granuloma, dermal tuberculosis, fungal infection in foreign body granuloma. Sometime a foreign body came into a eyelid and it caused a type of swellings, etc., which look like a chalazion. So the main important things are these two, the first two and the last one. These must be remembered. This can be asked in the MCQ's point of views. Lastly, we have the treatment of the chalazion. So what we do in the treatment? First of all, we have three categories. Our first priority will be conservative treatment. Number second will be medical, and number third will be surgical. So in conservative treatment, what we do, we wait for the chalazion because sometimes it resolve on its own. If it doesn't resolve, if we go for expression and compression therapy. In this procedure, what we do, we compress the affected area so that the build-up oily material came out through the blocked duct, and then we compress it through warm clothes, etc., or warm cotton. Third, we have a warm compression on warm cotton or warm cloths, etc. And the two last, we have a topical application of steroid and antibiotic combination or anti-inflammatory combination. The second priority we have is medical or medicine prescription material treatment. What we do, if it is very high in size or persistent for long time, we prescribe a steroid injection named triamcinolone acetonide. Its dose is almost zero point 0.1 to 0 0.2 ml, but it is injected to the conjunctival side, not from the external side of the eyelid, and its success ratio is almost 80%. But if it doesn't resolve with the first dose, then we prescribe the second dose. In the second dose, we do on the second week. uh, Apart from it, we also prescribe systemic antibiotics when it is associated with acne, rosacea, or pleveritis. Now we have the last, surgical treatment. So what we do, it is the most common treatment. And first we provide the local anesthesia around the chalazion. Then we pick up the chalazion clamp, which is here in this diagram, and we give vertical incision. In this diagram you may see this is a chalazion. Now what we do, in this chalazion clamp, we hold the eyelid, and then avert the eyelid, and from the conjunctival side we give a vertical incision, and then we withdraw all the fluid very carefully, so that this doesn't spread to our eyeball. And then what we do, we compress it and leave it for healing process. So what we have said, that we give a vertical incision on the conjunctival side and remove the contents very carefully. Then what we do, after the surgery, we provide a post-surgical therapy, which is antibiotic steroids combination. We apply this topically for 1 week almost. Then a very small topic we have here is marginal chalazion. What is marginal chalazion? Actually, the meibomian duct block, and it actually project to the lid margin, due to which it appears just like very on the margin side. So we called it marginal chalazion. Number second, sometimes it is not the meibomian glands disorder, but of the disease gland disorder. It is actually an isolated inflammation of the disease gland. But if we look at its characteristics, it's wholly similar to a chalazion, so we call it marginal chalazion. Allah Hafiz.